Hi, today I'm going to administrating IV medication by piggyback to patient. First, I need to prepare the stuff. So I put the camera here, you could see. A medication, mini bag, swab, alcohol swab, label, syringe, needle, and secondary line. Then I need to check for client's medical history and allergy and compare it to the prescription. Then I will check the MAR and prescription to make sure everything is correct and right for this procedure. Here is MAR. I need to check for the patient's name, date of birth, name of medication, dose, route, and the date and time of administrating. Here is the medication is pantoprazole, dose 40 milligram through IV every 6 hours. The first time and now is 8 in the morning that I'm going to administrate it. I will compare it with the orders too. Everything is the same. So I could start. Second, I will go and check for the medication. The medication is pantoprazole 40 milligram, and the expiry date is November 2021. Second, I need to check for mini bag for expiry date also. It's February 2022. So, now I have to calculate and know how much of the medication I need to give to the patient. Here it's mentioned it's already reconstituted for 3 milliliters of medication. We need to inject a mini bag, and I need to calculate the flow rate as well. It's the mini bag is 50 milliliter, so the drop factor is 10 GGT milliliter per milliliter. I will multiply them and then divide it by 13 minutes. I will find 17 GGT per minute for flow rate. So now I know everything, and I should make sure that the medication is compatible with the primary infusion solution. So everything is okay, and I will do the rest. Okay, now I'm going to draw a medication and inject it in the mini bag. First, I will hand hygiene. I already prepared the label for that I need to put it in the mini bag, but I don't stick it on the mini bag until everything is prepared and okay. In the medication label, I have to put the patient's name, drug name, amount of the drug, added by the initial of the nurse, and the baseline date, that is today date, start time, and flow rate. I already all this stuff to the label. So first, I'm going to clean the mini bag, and then I will clean this here for 15 seconds. I will put the swab here, so in order to prevent any contamination. Then I will recap the pre-reconstituted medication. I will clean the rubber cap as well. It's clean, but I will clean it as well too. I need, as per the prescription, I need 3 milliliter of the medication. So I will use the 3 milliliter syringe. I will make sure not touch the plunge of the syringe. Okay. I need 3 milliliter, so I will put and draw back, pull back about 3 milliliter of air. Okay, and then I will inject it into the medication. I will put the air in the medication, and then try to draw back of 3 milliliter of the medication. I will try to dispose the air. I don't want any bubble, any air. Yeah. Good. Perfect. Yes, it's 3. Now it's 3 milliliter of the medication. I'm going to inject into the mini bag that I already cleaned with the swab, alcohol swab. I will put the medication. I will recap it, and I have to put the syringe with needle into the sharp container without any cap, but because of security I will put it in cap, and I consider it's a sharp container. So I have to just back and forth of the mini bag. Everything is okay now. Now I have to check again and do the second check about the name of the medication and dose against the MAR. So the name of the medication is for patient PNL. The drug is pantoprazole that I added. It's pantoprazole 40 milligram. And it's it's according to the mark, and yeah, today it is okay, everything is okay. I will do the second check, everything, I make sure that everything is okay. So now I will put the label on the mini bag, but I have to put it at the back of the mini bag. So the other information be clear. So up to now I checked twice everything, the medication, the right dose, right name of the patient, and make sure everything is okay. Now I have to go into the patient's room and do the rest of the procedure. I have to put the I have to carry the mini bag, alcohol, secondary line, and MAR. I have to go to the patient's room now. Okay, for example, here. Miss PNL. How are you today? Good. My name is Fatima. I'm your nurse. I'm going to administering IV medication by piggyback today for you. I need to ask you full name and your date of birth. Okay, your full name. Perfect. Thank you. Can I see your rubber band, please? Okay, perfect. Thank you. Do you have any kind of allergy? Any allergy? Any medication allergy? No? Perfect. Thank you. So let I sanitize my hand and see the location of the and see your hand. I can just a minute. I will put my gloves on. Is everything okay? No pain? No incomfortability? Okay, good. Let's start. First, I will check your, no, your hand, the side. Okay, no redness. I will check for pain, redness and infiltration. Is there any pain? Any tenderness here? No? Okay, perfect. Thank you. So I can continue my job. Before I continue and open the secondary line, I need to do my third check. I have to check the medication name, the amount, and compare it with the MAR again. The drug name is pantoprazole, so the label is the same, the medication is the same, 40 milligram. And time is 8 in the morning. That now I'm trying to inject it. So I will open. I will use the hanger to put the primary bag. I will hang it. I have to make sure that the mini bag be upper than the primary bag. I will hang it and then I will show you how I put it. And make sure that the primary line now is closed. I will show you. And the primary line is closed now. I will use the secondary line. I know it's clean. It's clean also. I will recap it. And this one too. I try to put it together and make sure that it's closed. First, I have to make sure that the clamp is closed in order to not waste any of the medication. I will hang it upper than the primary bag. I know that I don't have to touch anything, but I need to show you. I will recap this one. I will open the clamp a little to make sure the medication is coming down. There is no blockage, no bubble. So a little I will open it until find, yeah, it comes. So I will close it again. Everything is okay, no blockage, no bubble. I will make sure that everything is going well. I have to connect it to the primary port that is near to the port that is near to primary bag. But I need to clean it with the alcohol swab. I will clean it, the port for 15 minutes, 15 seconds, sorry, 15 seconds. Okay, now I will connect it. Good. Everything is okay. No bubble, no leakage, no leakage. Before I open it, I will flush this port with the normal saline. I will flush it. For example, I will flush and then make sure there is no blood here, no blockage, everything is okay. Then I can open the secondary line. I will open the secondary line. Yes. And try to, I will open this one as well. I will calculate in 1 minute. It should be dropped, 17 drops, and comes down into the patient's hand through the secondary line. So now everything is okay. When I make sure that everything is okay, I will ask the patient if there any uncomfortability or any pain, any tenderness, any complaint. If no, I have to go back and I will remove my gloves. I will go back and do the documentation on the MAR as well and document also. Okay, thank you.